And new research out of Sudbury is shedding light on a gap in our healthcare system when it comes to youth. The study examined young people struggling with substance use disorder. CTV's Amanda Hicks has the details.
For young people dealing with substance use in the North, the emergency department is often the only place to turn. But according to new data from HSNRI research scientist Kristen Morin, that visit is often just the beginning of a repeating cycle.
Substance use is a really prevalent issue, especially in Northern Ontario, and youth is a higher risk group. And so these kinds of studies that we're conducting are really trying to identify ways to improve the system for vulnerable populations.
She and her team examined health data from 6,500 patients over 5 years. The results determined that youth experiencing substance use disorder under the age of 18 are more likely to be readmitted to hospital within 30 days compared to adults.
It's a good indicator of whether or not people's needs were met at the hospital, if appropriate follow-up care was conducted, because if they do come back within 30 days, then it means potentially that we didn't meet their needs, or that they didn't receive the care that they should have gotten, so they have to come back right away.
While adults often face long-term struggles, the research indicates a critical window. It says if a young person can make it past the first 30 days without returning to the emergency room, their chance of recovery improves significantly. However, for those in the transitional age gap of 18 to 24, the risk remains high, suggesting that as soon as they age out of youth services, they are falling through the cracks.
The main message from this study is that the emergency department shouldn't be the end of care, but it should be sort of a place where we can set up follow-up care for people.
Moving forward, Morin says her research on this topic will continue to see how care can be improved and how community groups can help. Amanda Hicks, CTV News, Sudbury.